There's a very important study came out about testosterone, and I think every practicing doctor in the United States should know about it, but they don't. It got moderate attention, but not nearly enough. It's called the T4DM study, and it was done in Australia at multiple centers, and it looked specifically at testosterone versus placebo, or really no treatment, no testosterone, in men who had an abnormal glucose tolerance test. So their blood sugar metabolism was off. Some of those men who had the abnormal glucose tolerance test actually had true diabetes, and others were just basically at risk for developing diabetes. All the men had to undergo what we call behavioral intervention. They all went to WW, which used to be called Weight Watchers, and they then were coached on diet and physical activity. So half that group then were randomized to getting testosterone injections, testosterone undecanoate, and the other half didn't get anything. And it was a 2-year study. They enrolled over 1,000 men. That's a big study. 2 years is a long time to do a randomized control trial. And at the end of the study, the number of men who had diabetes, true diabetes in the testosterone group, was 12%. In the group that didn't get testosterone, it was 21%. Not quite double. But testosterone treatment greatly reduced the number of men who progressed to real diabetes. In that study, there was also a percentage of men who started with diabetes before they even started in the trial. And I forget the exact numbers, but the number of men who no longer were diagnosable with having diabetes was very substantial in the testosterone group. There were some in the group that didn't get testosterone, but far fewer. And all these intermediate parameters that we look at, things like fat mass and muscle mass and all that, they all were better in the testosterone group. And so you put it all together, we care so much about the treatment of diabetes and the awareness of diabetes in this country. Here is a medicine, testosterone, who, if these men were deficient in it, lowered the rate of progression to diabetes amongst men who actually had diabetes. A substantial number no longer had it at the end of the study. And then all these various metabolic factors were better too. Unbelievable. I think it's high time. I think the evidence suggests that we should be doing regular testosterone testing in men. Certainly at least once from men who are 30, 35 onwards, at least to know what their baseline is. And in older men, even more frequently, maybe even once a year. And people say, well, why? What are we going to do with it? Are we going to treat all these guys with testosterone? Maybe, maybe not. But if you don't have the information, you don't have anything to go on. We do routinely, we forget that TSH, thyroid stimulating hormone, is pretty much a routine annual blood test for many physicians. The yield of finding thyroid disease with it is extremely small. The cost of a testosterone test is the same as a thyroid test. It's not more. And I would argue that the yield, the ability to find something that is actionable or that's going to make a difference for somebody, is far greater with measuring testosterone in men, especially as they get older, than it is with thyroid testing.